Welcome back to Talk with Terry Tuesday. I am Dr. Toni Scott-Terry. I appreciate you guys tuning in about another educational podcast that we're going to do. I know you guys have been faithful. The summer has been busy, I'm sure, for everyone. People are taking their kids back to school. I have 2 weekends that I have to take kids back to school. So, one of my patients said today, the struggle is real. It is real. So, I'll be out of the office this weekend, next weekend, taking kids back to college. So at least they're in college and they'll be gone for a couple months. But we're excited to be back. We'll start getting back into the swing of things in September when everybody's kind of settled down. So we're excited to be here today. So let's get into it. We're going to talk about bioidentical hormone therapy today. So people have heard of HRT is some of the things. There have been shows that I've seen recently. I think Oprah talked about it. Um, who else? There was a couple of other people who were talking about it on some of the TV shows about just these changes that we go through. So I just had another birthday, so yay me! And with each birthday comes some different changes and some challenges, but that's okay. Glad to have them, but there are things that we can do with these challenges. Now, when I'm talking about hormone replacement, I don't mean just for women. I mean hormone replacement for men as well, because that is a huge misconception that only women go through the change. No, that is men go through the change as well. Their change may be a little different than what ours are. But basically, there's a menopause, there's an andropause. Menopause is usually what women go through, andropause is what men go through. All it means is that your hormone levels are changing. And for the most part, that means they're decreasing. And when that starts to happen, there are a lot of different changes that your body will go through. Now, before people would say, well, it's just a part of the change and you just have to get through it. Well, it's not that easier said than done. And I will say 40, 50, 60 is not what it used to be. So we are more youthful, we're more active. I don't have grandkids and, you know, not really ready for grandkids. Like, who's calling me granny? No. But anyway, I digress. Um, we all go through it. And when those changes start to happen, it affects you. You're tired, you have fogginess, you're moody, um, intercourse is different, your sex drive is different, your muscle mass is different, your joint pain is different. Is anyone have these symptoms that they have heard of? Most of us are actually going through those changes, but nobody talks about it. They just talk about the hot flashes. And hot flashes, yes, is a big part of it, but there are so many other things that are starting to happen to us, and a lot of us don't understand why. Um, I am here to tell you that there are changes that will occur. There are things that we have to change, but there are also services that we can provide that actually help you go through this life in a better position. So, what are bioidentical hormones? There are a variety of them. There are oral medication, there is creams, there are injections, there are pellets, there are troches, which are things you put under your tongue to dissolve. So there are a lot of different types of hormone replacement. For men, the insurances will a lot of times cover testosterone injections for them. Why don't they do the same for women? Well, we're working on that. But right now, for men, if your levels are below a certain amount, and that will vary, usually it's below 300 for most insurances, but you have to check with your insurance. They will sometimes cover testosterone injections. And that is something that you may have to do daily. You may have to do it once a week. It depends on what type they give you, but there is something that will help prevent, once again, the fatigue, the feeling that you don't want to do any of the things that you used to enjoy doing, such as golf or going out with your friends or things like that. Anxiety starts to increase. Abdominal size starts to increase. Your muscle mass starts to be less. All those things are related to low testosterone. What I do tell men is that when your levels go below a certain point for men, the risk for heart disease starts to decrease. There's also been, and we can go back and forth with this, for men who've had prostate cancer, because what was told previously was that it was the testosterone that was causing it. That's not the case. And so they've done a lot more research, a lot more studies regarding that. And men who have had prostate cancer, if you have been prostate cancer free for over a year, that is something that we may be able to discuss with your physician as far as whether or not you would be a candidate for testosterone replacement. Um, I do more of the bioidentical hormone replacement, and that includes estrogen, testosterone, progesterone, and that is because it is the same molecular structure, very similar to what your natural one is. So it doesn't really interfere. It's not a synthetic one. And so once again, just know what you are getting when you are doing hormone replacement. I still write prescriptions for estrogen and progesterone replacement, but I'll usually do a patch, I'll do a cream, or I'll do a ring because it's absorbed differently. When you're doing an oral synthetic hormone replacement, sometimes the changes can be a little different and it can affect you a little different. Not saying that you shouldn't do it, but what I am saying is that there is some difference with the synthetic hormone replacement versus bioidentical. And I do both. So I'm not saying don't do synthetic, don't do the oral medications. That if that's what your insurance will cover and you are suffering, then that is an option for you. Um, Now, we've talked about a little bit about information as far as testosterone replacement for men. And men, when you go get your PSA checked, when you go get your labs checked, have them draw your testosterone levels so you can see where you are. And then it's up to you to decide if that's something you want to do. I tell all of my patients that you need to increase your protein intake. You need to change a lot of the sugar and processed foods because that is going to affect your hormone levels. And as we get older, once again, your hormone levels are going to decrease. Exercising, doing weights, doesn't have to always be very heavy weights, but building muscle mass also helps improve your levels. So those are things that you have to stay on top of. Now, for my women, yes, you produce testosterone as well. You don't produce the same amount as what a male would, but you do produce it. And when those levels start to decrease, when your estrogen levels start to decrease, when your testosterone levels start to decrease, you're going to have a lot of those symptoms. One of the biggest symptoms that people complain about is the mental fogginess, is the low libido, is the feeling very fatigued, um, the changes with their sex drive, losing muscle mass, gaining weight in the abdomen. Those are changes that can occur. And if so, people will go, they'll ask their doctor, well, what do I do about this? And depending on the doctor, hopefully they will tell you that there are some options that you can do. And there are even options that you can do for hot flashes that are not hormonal based. So there's a variety of different treatment options. You just have to find a physician who understands all of those things. So getting back to, because our topic is bioidentical, so getting back to those, what I tell people is that you don't have to be in menopause for your testosterone levels to be lower. If you're starting to have a lot of those symptoms, you may want to have your physician actually check those levels to see where you are. What's the average age of menopause for women? The average age is in the United States is 51. Some people are a little earlier, some people are a little later. Everybody's going to be different. But some of these symptoms will start before you stop having your periods and go through menopause. Um, Now, how do we give hormones? Once again, you can do creams, you can do pellets, you can do topical medication, you can do vaginal inserts. There are a variety of ways you can actually deliver the hormones to you so that you feel better. How long does it take for them to kick in? So for pellets, people will start to notice some changes anywhere from a couple days to 4 to 5 weeks. Everybody's going to be different, and every symptom will start to improve at a different time. So you won't just get the pellets or you won't just get the cream, and then tomorrow you are back to your norm. Doesn't work that way. But it does metabolize over a period of 3 months for women and about 6 months for men. Um, they're inserted underneath the skin. The procedure itself takes me probably about 60 seconds to do. This is not a painful procedure. This is not something that you need to be sedated for. It literally takes 60 seconds to do the procedure, and you're on your way to feeling back to your norm. Um, what I have people do, once again, I said with the pellets, they last about 3 months for women, 6 months for men. You have to get labs checked. We need to know where you're starting, how you're feeling. I do blood. Some people will do saliva tests, but I do blood tests so that we can actually see where we're starting and what levels we end up at. Um, it is something that truly changes people's lives. So I get them. Um, some of my staff get them because we gotta have a work environment. so, so, and it works out better for everybody. It's so when you come in, we're smiling, we're laughing, we're in a better mood. It definitely changes your life and it puts you back to feeling like yourself, which is what most of us want to be. You just want to feel like yourself. I encourage everybody to take their vitamin D because that also helps with fatigue, helps with your bones, it helps with metabolism. So we definitely encourage vitamin D and B12. So you've got to do your vitamins, but once again, this is just the information that I want people to have because people are suffering and they don't know why or what to do. We are actually having a seminar on September 26th, that's a Thursday, from 6 to 8 regarding bioidentical hormone replacement. And this is a free seminar. We just want people to have the information. So if you get pellets or you know someone that needs pellets, and you know who those people are, this is a free seminar. This is about giving you the information so you can decide how you want to proceed with your health. There are lots of benefits, not just, once again, the moods. They've done studies that it decreases Alzheimer's. So if you have gone through menopause, if you start hormones within, well, the study showed that if you started it within a 3 to 4 year period of when you've entered into menopause, your risk for Alzheimer's and dementia decrease. So once again, it's not about just the libido with testosterone. It helps with a lot of different factors and functions of your body. So in the webinar or in the seminar, um, you can, whatever questions you have, that's when you can come and ask all those questions. There'll be a lot of my patients here who actually receive pellets that can give you their experience. Um, Once again, I take them just because for me, it was the fogginess, not being able to come up with simple words or can't remember why I walked into this room. That got tiring and very old very quickly. So I feel like myself. And once again, there's some other benefits that have come with it, but you start to be yourself. The weight, this is not a weight loss, but it does help you with your metabolism. So those are things that we're just trying to balance. Because once again, what was when our parents were 50 is not the same as how we are now at 50, 60, 70, 80. My father-in-law is past 85, I'll just say that. He still drives, he still works, so it's very different. So these are just things that will help you kind of go to that next phase and not be miserable. So I'll answer some questions if anyone has any.
There are three quick questions.
Okay.
The first is, who is not a good candidate?
So, once again, if you're a male and you've had recent prostate cancer, we tend to wait about a year or so before we do that. And there are certain hormones, like for if you've had endometriosis, I would not give that person estrogen because it could still stimulate areas of endometriosis that you may have. So everybody's a little different. It would have to be a personal consultation to determine for sure who would not be a candidate.
At what age can I start using this?
It's not necessarily an age. It's more so of where your hormone levels are and what your symptoms are. I've had 30-year-olds with very low testosterone. And so if your levels are low, if your symptoms are bad, um, you are a candidate. But we just have to check that. And we do the consultations because we want to know for sure kind of what it is that your concern is so that we are actually treating what your concern is.
The last one, what are the side effects?
So the side effects are dose dependent. So if you are using, and I'm more conservative, especially when I am just starting someone on hormone replacement, because I can always go up. With pellets, I cannot take them out. They will dissolve on their own. The pellets are made out of yams. So the higher the dose, people can have increase in facial hair, they can have increase in acne, they can have enlarged clitoris. So there can be for men, if the dose is really high, the testicles can get a little smaller. So everybody is individualized. Everyone is not on the exact same dose. Everyone doesn't get it at the exact same time. This is an individualized treatment. And once again, I can always add, I cannot take it out. If you're doing creams, then creams are a little different because you have to apply the cream every day. If you don't apply the cream every day, the levels go back down. So, same thing with the injections. I don't like injections for women because I don't like how it increases your levels rapidly, but it drops down just as rapid. But for men, if you miss an injection, your levels are going to go back down. So you have to kind of stay on top of that, but it's dose dependent. I can kind of show you. I don't know if you're able to see this, but this is a pellet. This is 100 milligrams. For women, the dosing can range from 87.5 to 162.5. It just depends on where you are. This is a 25. I don't know if you can see this one, but they're small. For men, it can range anywhere from 1,200 to 2,400. The dosing is going to be different depending on your age, your weight, your body type, your muscle mass, where your levels are. So there's a lot of different factors that go into dosing you. And once again, I'm a little bit more conservative. So your initial dose, I'll kind of, we'll put in the numbers and kind of see where you are. But if you still feel like you haven't quite gotten back to yourself, then we have you come back in 4 weeks and then we can actually adjust the dose and add a little bit more. But this is the QR code. I don't know if you can see it. But if you are interested in coming to the hormone seminar, you can scan this and you can register, because we do need you to register for this because we had so many people the last time. We want to just make sure we are ready and that we have enough packets and information for everyone that wants to attend. I'm trying to think. I think we did it did it virtual as well. I can't remember, but that may be another thing that we can consider, is to actually do another virtual for those who can't make it out to the seminar. But there were a lot of good questions that were asked. There were answers for each individual. People will put me to the side, so it should be a really good turnout. So, like I said, if you're interested or you know people who might be interested, who've asked you questions about it, you can have them scan the QR code, or they can call. The number here is 708-895-8497. That's the office side. And the medical spa side is 708-864.
I want to say happy birthday to you. Happy birthday, birthday.
So I wasn't expecting this. So
Happy birthday, happy birthday.
I'm 45.
Plus 10. We gonna head out, y'all. Happy birthday.
This is why we got to take kids back to school. Oh, thank you. These are beautiful. Thank you, guys. See what colors do for you. So, so, and I just love my staff. They are so wonderful. And I will tell you, people don't get enough credit when you do good. When you hear bad stuff, people will tell you, but they don't get told enough. They are wonderful. They are excellent. I just love them and thankful for them. So come on in, staff. Okay. They're fighting. Okay, everyone says hi. That's my birthday wish.
Hi.
Okay. This is Jen.
Wait, go back to. Oh, I'm right here.
This is
Hi.
Jen. Who's next? Come on, come on.
You guys gotta go.
This is Chloe. This is the college student that's leaving on Friday. Come on, Rachel. This is Rachel. Rachel's going to be starting nursing school. Come on. Let's come on, people. I know people have left out.
Come on.
Come on, quickly. We have office after this.
Come on.
Here's a card. You want to hand her jersey? Okay.
Come on.
Thank you. This is one of our medical classes. I have to fight them to come on. This is Isaac. This is our This is Bonita. This is our spa manager. And then we have Kathy. Come on around. You got to come on around like everybody else. Because she's always taking pictures of everybody. And this is Kathy. This is our manager. So thank you guys for attending. Give us a call at 708-864-4988. Our address is 7151 183rd Street. And once again, the seminar is going to be September 26th from 6 to 8. And we are going to be doing another men's health and wellness seminar. It was such a good turnout, and everyone kept asking, when's the next one? So it's going to be sometime in October. We are trying to finalize everything now with the all-male panel. So we should have that taken care of over the next week or so. So Remember, be well, be blessed, and be healthy. Thanks for tuning in.
I absolutely love it. Be well.